Good afternoon. Thank you for joining us for today's ASPPH Presents webinar, Policy, Advocacy, and the Missions of Academic Public Health. This webinar is part of the ASPPH Presents monthly series, which has been designed as a service to CEIF-accredited ASPPH member schools and programs of public health. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation, but may address a few burning questions throughout the webinar. This webinar is being recorded and will be available on the ASPPH website soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. Our speakers today comprise the ASPPH Policy and Advocacy team, Tony Mazzaschi, our Senior Director for Policy and Research, and Ebony Allen, Policy and Legislative Analyst. Thank you, Tony and Ebony.
Great. Thank you very much, Sarah. It's a pleasure to be with you today. Obviously, for most associations, including ASPPH, advocacy is a critical part of our mission. Our mission, of course, is to transform public health by strengthening and promoting the education, research, service, and practice activities of CEIF-accredited schools, and to advocate for the investment in science needed to advance population health and for evidence-based public health policies and programs. And obviously, advocacy is a key strategic priority to achieve that mission. We're led in this effort by our elected leadership, and the research committee chaired by Martin Filbert, the dean at the University of Michigan School of Public Health, provides essential advice to us on regulatory and legislative activities. And our legislative priorities are determined by our legislative committee chaired by Howard Frumkin, the dean at the University of Washington. These committees play a critical role in helping us establish our priorities and give us advice throughout the year because we need help as new issues come to the fore that aren't always predictable. We have under contract Cornerstone Government Affairs, which is a very highly respected Washington lobbying firm. They have helped represent us on Capitol Hill since 2004. The lead executive is Mark Mazzaschi, who for many years was on the Senate Appropriations Committee staff, joined by Amy Ford Souders, who also was on Appropriations Committee staff, and most recently Eric Fatimi, who was Senator Harkin's chief staff person on the Appropriations Committee until his retirement. Advocating for public health and through the association it's an interesting process. We have asks that we go to policymakers, especially on Capitol Hill, and ask for support for various programs. But just as often, Congress asks us for advice and counsel on public health issues, especially academic public health issues, that they need advice and counsel on. And we also work very closely with the federal agencies who also are seeking advice, as well as our ability to communicate with academic public health leaders. We also play a critical role in advocating for academic public health with other associations and higher education and research colleagues. We're a fairly small association in Washington terms, and much of what we do on behalf of federal agencies in trying to seek support for federal agencies that help fund our missions is work as a key partner with various coalitions. Here are the logos of many of the groups that we work with. They range from other associations of schools of health professions, other organizations representing sectors of the public health community, other healthcare partners, as well as groups that have an interest in public health that may not be immediately in mind, such as architects and traffic safety groups. We increasingly have become involved with groups that are working on the tobacco issue, trying to strengthen the regulation and efforts to curb tobacco use. As I said, we're a fairly small organization, and we have to be very careful about what issues we put on our plate. We have developed an advocacy taxonomy. As you all know, every issue in Washington is about 2 degrees away from being a public health issue. So we have to make decisions on how to allocate our resources based on how we can best serve the interest of our members. And we try to spend 80 or 85% of our effort on those issues where we can be a major debate participant, where we can be a prime mover, and where we can really be actively engaged. And by actively engaged, that often means it's an issue that we can bring our members to the table so that their voice can be heard directly. Now, there are 3 major sources of federal support that come to schools and programs of public health. The one that everyone thinks of course, is research support from various federal agencies. This chart just gives you some of the larger players, and as you can see, we receive a tremendous amount of support from the National Institutes of Health. Most gratifying here is the slope. As you can see, we've slightly increased the support to schools and programs of public health in the last 3 years, and we're the only health profession that has a positive slope with NIH, given the state of the budget. We also receive support from CDC, HRSA, Agency for Healthcare Research and Quality, USAID, and it stretches to other agencies where the amount may be small, but we make a critical difference, such as the National Highway Traffic Safety Administration, the Veterans Administration, and other federal agencies. In Washington, however, many people think that we receive much more support from the CDC than we actually do. CDC does not have that much, that many research accounts that are competitively funded that would help our members. Overall, in the research side, NIH is the big player with, of the federal agency money that goes to schools and programs of public health, 57% of it comes from NIH and only 15% from the CDC. To give you an idea how critical this support is to our members, we receive more NIH dollars per full-time faculty member than any other group of schools of health professions. In fact, double what allopathic medicine receives. The average full-time faculty member receives just under $160,000. Now, some of this money is pass-through money, but it's still a tremendous amount of support that comes to our schools and programs of public health. Of course, another major source of federal support comes through state and local health departments. Increasingly, the state and local health departments are supported by federal funds. Recently, that amount of money topped 53% of all money for state health department comes from federal money. Now, this money doesn't tend to go to our schools directly, but through subcontracts and other awards, but it's a critical source of practice support. Also, of course, increasingly, federal loans, which help support the tuition expenditures and the tuition receipts at our schools, federal loans are our key source of support. The average per graduate student now is a little over $16,000 in federal support, federal loans to each student. This has grown exponentially in the past few years, and increasingly the association is paying attention to student loan and student financial issues, which are increasingly in play in the federal government. In fact, recently, for the first time, federal support for higher education is now greater than state support. And for most of this country's history, education was in the purview of the states and local communities and not the federal government. We've only had a Department of Education for about 10 years, but now federal support has topped state and local support. Well, let's talk just a little bit about politics because politics shades everything. I mean, the real definition of politics are the rules that help govern our life. Around Washington, there's a running joke that politics really means, if you go back to the ancient Greek roots, poly meaning many, and ticks meaning blood-sucking parasites. But in reality, politics, academic politics and political politics are critical, and we have to play the game. The atmosphere in Washington, as you all know, if you watch TV and Fox News especially, is been particularly vicious. And as angry as some of it may sound if you watch C-SPAN or the television networks, actually things increasingly have been getting done. And the evidence of that is the omnibus appropriations bill that we'll talk about in a minute. But there still is a lot of anger, but we have noticed that it's being tempered a bit. And increasingly, things are getting done, as difficult as it is watching it unfold. Part of the reason may be when one looks at the Senate. This year, the Senate is, of course, in the hands of the Republican Party, but it's close. It's 54 votes for Republicans and 46 caucus with the Democrats. That includes 44 Democrats and 2 independents. But more importantly, when you look underneath the numbers, you see that of the Republicans up for re-election next year, many of them are in states that were carried by President Obama. And almost none of the Democrats, in fact, none of the Democrats that are up for re-election next year are in states that were that went with the GOP in the last presidential election. Now, when these individuals ran, of course, it was 6 years ago, and that's a non-presidential year. What's happened is that many of the Republicans that are up for re-election have been unwilling to take what we would consider extremist views on some of the issues before Congress. And as such, that's increased the frustration of the House Republicans in their ability to enact major significant ideological or policy changes that they've been advocating. Washington has been, for several years now, focused on deficit politics, and everything has been about reducing the deficit, constraining federal expenditures in an effort to curb the deficit. We're seeing less of that. As you may know, the omnibus appropriations bill that's being considered now would actually increase spending by $56 billion, according to a Congressional Budget Office estimate issued yesterday. The focus in Washington has been on domestic discretionary accounts, but when you look at the tax dollar and where the money goes, you'll notice that for science and science agencies, they only receive 1.1 cents on the dollar, and education only 2.5%. The entire focus of the deficit debate has focused on the right side of this dollar bill. And of course, that's the smallest part and the one that's very hard to constrain any further. Whereas there's been almost no change in the Medicare program, military, and some things you just can't touch, such as the interest on the federal debt. Veterans benefits have increased. Social Security, no one wants to touch. It's the third rail of American politics. So all of the focus on deficit spending has come on domestic discretionary programs where most of our priority accounts lie. And the impact of this long-term on federal agencies that we support has been pronounced. Here is a table that Francis Collins, the director of a chart that Francis Collins, the director of NIH, has shown that shows the difference between current and constant dollars on the NIH budget. And even though NIH went through a sustained doubling period, they've now lost that entire gain due to constrained appropriations for the past 10 years. Well, now let's turn to the Omnibus Appropriations Bill, which was released earlier this week. It will be voted on tomorrow by the House of Representatives and this weekend by the Senate. I think you should strap yourself in for a rough ride. We may see the bill fail the first couple of times it comes up. It's not gathering much support, especially the appropriations bill from House Republicans. It's probably going to take a majority vote from the Senate, from the House Democrats for the appropriations part of the bill to pass. There is a companion piece that will be merged with the bill that extends various tax provisions called tax extenders. That will pass handily by both parties, but it's the appropriations that will be hard to pass, and it may take most of the weekend for the pressure of the bill and for it to finally pass. So first and foremost, we advocate for key federal research agencies that support the mission of our schools. And we try, first and foremost, to advocate for the agency as a whole. For the National Institutes of Health, which has been a favored account for several years with both Republicans and Democrats, it received a very significant bump this year of $2 billion in the omnibus bill, which is a 6.6% increase. Now, we can talk a little bit about what has gone into that bill, because there are some things that are quite of interest to us. For example, the bill provides significant money, $165 million, for the follow-on to the National Children's Study called the Environmental Influences for Children's Health Outcomes Program, which we've had a strong interest in. But it also provides a very large increase for Alzheimer's research, a $350 million increase to $936 million. It increases spending by over $100 million to combat antimicrobial resistance. It also provides $200 million for the Precision Medicine Initiative, including $130 million for the cohort study and $70 million for the National Cancer Institute. So overall, it's great news for NIH. Equally, the CDC, which in the early part of the appropriations game looked like it would not do very well, in the final agreement, it had a major boost of the total appropriation of $7,233 million, which is a 4.1% increase, an increase of $168 million. And we'll go into the details of that in just a second. HRSA was increased by just 0.6%, 0.6%, a $37 million increase. But actually, that's a great recovery as well, because earlier in the process, it looked as though it would take a decrease. As important, the Agency for Healthcare Research and Quality, the House of Representatives, the House Appropriations Committee, had proposed killing the agency. The Senate proposed a 35% decrease in its budget. But in the final appropriations bill, it received an appropriation of $334 million, which on paper looks like an 8.5% reduction. But when you consider the $95 million it will also receive from the Patient-Centered Outcomes Research Trust Fund, the actual cut for the Agency for Healthcare Research and Quality is only 3.4%. Given how it looked as though the agency could be killed, that level of reduction is actually a terrific victory. So let's go into a little bit some of the programs that we specifically advocate for. Like I said, we first and foremost advocate for the agency as a whole, but then we are the prime support for key center programs within both the HRSA and CDC budgets. The HRSA Public Health Training Centers which got slashed in the Senate bill, was not funded at all in the House bill. We were able to save the program and bring it up to last year's level of $9.9 million. That's a terrific victory. The Public Health Traineeships program has not been funded in several years, and while we continue to advocate for it, neither the administration nor the House nor the Senate had included it in its request or its early bills, and it was not funded. Frankly, I think the Public Health Traineeships program is probably out of existence and will not be revived. Unfortunately, earlier, several years ago, the White House put this on a list of programs, STEM programs, science, technology, engineering, and mathematics programs that it wanted to consolidate, quote unquote, that is kill. And unfortunately, once it got on that list, it's been very difficult to save. The CDC Prevention Research Centers were funded at the same level as last year, $25.5 million. The Centers for Public Health Preparedness, again, got a little bump from last year to $8.2 million. The two NIOSH centers that we support, the Education and Research Centers, received a slight increase to $28.5 million. The NIOSH Ag, Forestry, and Fishing Centers got a slight bump as well to $25 million. We also strongly advocate for the NIH Office of Disease Prevention. We think that agency, the office within the Office of the Director, did very well, but the committee did not specify its actual funding level. And that's historic. It normally doesn't specify specific offices within the Office of the Director of NIH. So those are some of the key accounts and where they stand. Everyone is still examining the omnibus budget bill. It is over 2,000 pages long. The report that accompanies it, which has detailed instructions for all of the federal agencies, is also thousands of pages long. And while we have certainly combed the bill and report for items of concern to our constituents, the people in Washington and people supporting various agencies can be quite clever in the way they write various provisions. So we're still digging very hard to see where hidden stink bombs might reside, or other provisions of interest to our constituents. I'm sure that will continue as we go forward, finding new things that we can let you know about. Some provisions of key importance to our constituents. There was a proposal in the House bill to reduce the salary cap on federal awards to executive level 3. We strongly opposed that and were successful in keeping the salary cap at executive level 2. Executive level 2 is right now, this year, it's on a calendar year basis, is $183,300. It will be increased slightly in January. If it had been brought down to executive level 3, it would have reduced the salary cap to $168,700. As I mentioned, the Precision Medicine Initiative received $200 million, the Brain Initiative $150 million, the Environmental Influences on Child Health Outcomes $165 million. The conference report also contained a provision that in the NIH section stating that if any NIH grantee undertakes a human subjects study that generates data, that they must get a certificate of confidentiality. As you may know, certificates of confidentiality are a mechanism that provides some level of protection for the data gathered by researchers, and theoretically limits its availability under subpoena. And so those are generally handed out by NIH after an application. But the bill is mandating that certificates of confidentiality have to be obtained. We're awaiting further guidance from NIH as to how they will implement that. Also, the earlier versions of the House and the Senate bill contained numerous riders related to the Department of Education and its ability to issue various rules and regulations, some affecting for-profit institutions, state authorization for distance education. All of those riders were dropped from the final bill. So there's no limitation on the ability of the Department of Education to go forward with some of its regulatory proposals. Also in the bill, there was a major compromise on needle exchange programs. As you may know, for many years, there's been language in the bill barring any federal money from being used to carry out any program that includes the distribution of sterile needles or syringes. The new language continues the limitation on the actual purchase of needles, but does not put a limitation on programs that include needle distribution. Part of this was driven by the situation in Indiana, where opioid abuse had led to a major AIDS outbreak, and the rural drug crisis has actually helped convince some conservative members of Congress that the law needed to be changed. This new language is a compromise that's been strongly endorsed by the public health community, and we have to thank Congressman Tom Cole of Oklahoma for helping make this a reality. And we strongly endorsed the new language, as did most other groups in the public health community. A couple of other issues. Gun violence research has been in the news quite a bit, especially since the San Bernardino and Newtown shootings. The Democrats have made this a high priority, as well as the Prevention and Public Health Fund. The Prevention and Public Health Fund, as you know, provides about $1 billion a year. It was funded by the Affordable Care Act. This year, the bill was fully, the Public Health Fund, the PPHF Fund, was fully allocated by the Appropriations Committee. There is an effort by, anytime somebody in Congress makes a proposal to create a new program, they have to designate how they will pay for that proposal. And unfortunately, the Prevention and Public Health Fund has been listed in several different bills as the preferred pay for. But in any case, those haven't gone forward. And my colleague, Ebony Allen, will mention a little bit more about that in just a second. Also wanted to mention gun violence research. The appropriations bill continues to contain a long-standing provision that reads that none of the funds in the bill may be available for injury prevention control at the CDC may be used to advocate or promote gun control. Many people have characterized this as a ban on gun violence research. It does not ban gun violence research. It bans using such research to advocate or promote gun control. That said, CDC has been limited in its willingness or ability to fund gun violence research. 2 years ago, President Obama issued an executive order telling CDC to fund gun violence research. It has only funded limited research pending getting additional money from Congress. But this continues to be a very controversial area, and there likely will be an amendment on the floor when the conference report is considered to strike the language. Now I'll turn it over to my colleague Ebony Allen, who can mention a couple of things related that were in the bill concerning tobacco, e-cigarettes, and cigars, as well as talk a little bit about our regulatory advocacy portfolio.
Thank you, Tony. As Tony mentioned previously, a lot of our advocacy efforts for evidence-based public health policies happens via partnerships because we're a relatively small association. So in regards to e-cigarettes and cigars, there were 2 appropriations bills in the House. One was to target the CDC to reduce tobacco prevention funding efforts, particularly the Tips from Former Smokers campaign, which is partly funded by the Prevention and Public Health Fund. The other appropriations bill sought to restrict the FDA regulatory authority to oversee e-cigarettes and cigars. For the CDC, we advocated for $216 million, which is level funded from fiscal year 2015, but we got about $210 million for the CDC Office on Smoking and Health. For the FDA, the omnibus did not include the detrimental policy rider about the authority for the FDA to regulate e-cigarettes and cigars. Of note, we spoke with Brian King of the CDC Office of Smoking and Health, and they support the FDA's ability to regulate e-cigarettes and cigars. And they encourage schools and programs of public health to continue advocating for their inclusion in their tobacco-free policies on their campuses. Of note, the Tobacco-Free College Campus Initiative is one of our partnerships with the Department of Health and Human Services, and we conducted a member survey in October 2015, and we plan to release those results in early 2016. As Tony mentioned before, we send a lot of policy correspondence to various policymakers on a number of regulatory issues as well as appropriation issues. One of them being the Common Rule, which we've been seeking comments for that since August of this year, and that's very significant for schools and programs of public health in regards to their institutional review boards and human subject research. And we plan to submit those comments in January 2016. Another initiative, as Tony mentioned, was the NIH ECHO study, which was funded $165 million, and this provides a lot of significant funding to our schools and programs of public health. As he mentioned, the NIH is a big source of biomedical research dollars to our constituents. We also submitted comments on the Precision Medicine Initiative, and as Tony mentioned, the Prevention and Public Health Fund, which is the nation's largest single investment in prevention, and it's the federal government's only dedicated investment in prevention. This fund has been referred to as a slush fund and has been on the chopping block numerous times this year as an offset to pay for various initiatives that have been proposed by a lot of conservative Congress members. I mentioned our efforts on tobacco and e-cigarettes via our partnership with the Campaign for Tobacco-Free Kids. We've submitted several letters about the grandfather clause and weakening the FDA's authority as well as the CDC prevention efforts. We've also submitted comments on the NIH strategic plan as well as state authorization, and as Tony mentioned, no education riders that we know of so far were included in the omnibus, including student loans and state authorization, which specifically for our members, we asked for Congress to exempt public health programs from the U.S. Department of Education state authorization regulations. So I'll turn it back over to Tony to discuss more of our policy and advocacy initiatives.
Great, thank you, Ebony. I should mention on the NIH strategic plan, we commented on the framework. The actual strategic plan was not open to the public for comment on the substance of it. The NIH delivered it to Congress yesterday, and it's now available on the NIH webpage. And it focuses on NIH-wide initiatives, and it does not include individual priorities of the institutes and centers. I just wanted to end by talking a little bit about some of the things that we also do and that you might find of value. We do provide advocacy training for public health school leaders and faculty. At the upcoming ASPPH annual meeting, we'll be holding a workshop on creating state advocacy messages and building state advocacy campaigns, bringing in some national experts to help our faculty and leaders consider how to advocate at the state level. ASPPH does not advocate at the state level. That's the responsibility of each individual member in school that best knows state and local politics. But we are able to offer some training from recognized experts in how to do it well. We also help support our members who do Hill visits. On our webpage, you can find various fact sheets and talking points on various issues. If you have a Hill visit coming up, either on Capitol Hill or visiting with a congressman or senator in their local office, you should feel free to contact us to get the latest information on where policy matters stand, as well as advice on or information on where the local senator or congressman has what his public positions might be on some issues of concern to us. But we're always available should you need assistance. Frankly, faculty and our institutional leaders make the best lobbyists that are in town. They're passionate about the issues, and they have can put it in a local context, which frankly is much more effective. So I would urge you to consider having a visit with your local congressman and senator. It might be useful to talk to your campus government relations representative to get advice as to how to do that. It's always good to go through the local government relations representative so that actions can be coordinated. And frankly, the famous saying, all politics is local, all advocacy is local. The more you can put a local spin on the impact of these programs with your state representatives, the senators and congressmen representing your state, the more effective it will be. As I mentioned, our annual meeting will be held in March. Registration for that will open up momentarily, maybe even today or tomorrow, but it will be open very soon, and there'll be a number of public policy sessions during the meeting, as well as that state advocacy and communications workshop I mentioned. If you would like to get in touch with us, we have our handy email address, advocacy@asppph.org, and we welcome your comments, questions, and suggestions. So thanks for tuning in today. If anyone has any questions, please feel free to enter the question in the comment box. And if you'd rather send a personal question to the advocacy@asppph.org address, we'll get back to you as soon as we can.
Thank you, Tony, and thank you, Ebony. We will now take this time to address any questions that come in through the question box. But as we're doing that, I don't see any questions yet. I know that they can access you directly via the email address. Thank you all for joining us today, and please be sure to contact us with any of those additional questions that you think of. As a reminder, the recording of this webinar will be available on the ASPPH website soon at the address on your screen. And if you would like to register for the next webinar in the ASPPH Presents series, that will be taking place tomorrow, the CDC Public Health Associate Program and Best Fit Candidate Model Overview. And that the link to that webinar and registration is at the bottom of your screen as well. All right. Thank you all for joining us, and thank you again, Tony and Ebony.
Thank you.
Okay.